All right, so we are going to perform manual lymph drainage on our client who has unilateral lower extremity lymphedema without trunk involvement. So we'll start as always with the short neck treatment, starting with effleurage. Perform your abdominal breathing. My hand's right above her navel. Go ahead and take a deep breath in and relax. Take a deep breath in and relax. Take a deep breath in and relax. Take a deep breath in. Relax. Take a deep breath in. Take a deep breath in and relax, and take a deep breath in and relax. Take a deep breath in and relax. Last time, take a deep breath in and relax. Okay, so we're going to activate and work over the inguinal axillary anastomosis. All right, so in order to do that, this is our affected quadrant, this is our unaffected quadrant. We always start in the unaffected quadrant. My little pinky is going to be on that 12th rib. We're going towards that working axilla. Actually, both our axillas are working, so we're going towards the working axilla on the affected side. We're going to do this stationary circles 5 to 7 times. Okay, now we're going to go into the affected quadrant. My little pinky is going to be on that bottom rib 5 to 7 times, going towards the axilla. You always want to have skin-to-skin contact with your patients, so you would have them disrobe for this treatment. Now, in order to finish the open and activating, we're going to work from the inguinal to the axilla. So from the ASIS, inguinal lymph nodes to axilla lymph nodes, so ASIS to axilla. We'll do this 5 to 7 times. For the sake of time today, I'm just going to show you 2 to 3 times, but you would perform 5 to 7 times. Okay, so now we've activated and we've worked the inguinal axilla anastomosis. So we're going to stimulate the inguinal lymph node on the unaffected side. So my first hand placement, the knuckle is in line with that ASIS on my little finger. We're doing stationary stretches, so we're going down to the table, going up towards the working lymph node, inguinal lymph node. 5 to 7 times. Now you'll do more medial hand placement 5 to 7 times. All right, and we're going to activate and open the anterior interinguinal anastomosis. So we always start in our good quadrant, our unaffected quadrant. That's right here. My little pinky goes on that sagittal watershed. We're going towards the unaffected inguinal lymph node. That little pinky is on the sagittal watershed, but you're at a little bit of an angle 5 to 7 times, doing stationary circles. Now I'm going to switch sides of the table. We're going into the affected portion. So 5 to 7 times, going towards the working inguinal lymph node. All right, so now we're going to go from ASIS to ASIS right above the mons pubis, working with those dynamic stationary circles 5 to 7 times. Okay, so now we have opened and activated the AII. All right, so we're going to have the client get in a side-lying position with the affected extremity on top. You, of course, want to make your client comfortable. You might use a pillow to prop up their leg. You're going to watch her shoulders. She likes to crunch her shoulders up into her neck. All right, so while she is in this position, go ahead and rework the IA. When we rework something, we only perform it 2 to 3 times. So to rework, we only perform that last step where we're actually moving from the affected to the unaffected lymph nodes. So we're going to just perform stationary circles going from inguinal to axillary lymph node 2 to 3 times. All right, and while we're here, we can activate and open the PII, which is the posterior interinguinal anastomosis. This is our affected extremity. You always start in the unaffected extremity, and you always go towards the working lymph node. So we're going to put your little finger on that sagittal watershed. You're going towards the table 5 to 7 times. Skin-to-skin contact is necessary when working with your clients. Okay, now 5 to 7 times in the affected quadrant, going towards that working inguinal lymph node. Okay, now you're going across, right over the crease in the buttocks. Do this 5 to 7 times. Okay, so now we have activated and opened that PII. So our next step, we're going to perform effleurage on the lateral aspect of that leg. We're going to go all the way from the bottom of the foot all the way up the iliac crest, and you're stimulating the autonomic sympathetic nervous system on this, and you're trying to give enough pressure that she has goosebumps, which she has goosebumps, so that's good. That means I've stimulated that system. All right, so we're gonna we're now going to work. We're going to put your patient in supine. Okay, we're going to, while she's here, we might as well go ahead and rework that AII. So we're going from ASIS to ASIS just 2 to 3 times because we're reworking it. And we're about to start moving down and working on the leg. All right, so just 2 to 3 times. All right, so she's back in supine, and we're going to start working on the leg. So I'm going to start with that lateral aspect of the leg. I'm just going to start by doing some stationary circles going all the way to the inguinal lymph nodes. Now you can notice that my hand positioning is a little awkward, so if the clinician wants to change the size of the table, it might be a little less awkward, but in just a second you're going to need to be on this side of the table. Okay, so we're going to start working the anterior aspect of the thigh. You can use whatever stroke you want to. I am personally going to use a pump stroke going up the anterior over to the ASIS. You're going to do this 5 to 7 times. And then when I get up to her upper thigh, I'll switch over to dynamic stationary circles just to get up over that ASIS. So you do this 5 to 7 times. So we work the anterior aspect of the thigh. We're going to start working from medial to lateral on the thigh. We're going to have different hand placements. I'm guessing we're probably going to have 3 to 4, maybe 3. We're going to work medial to lateral. I'm going to use stationary circles. Each row that you perform with your hands has to be 5 to 7 times. So you're going to actually start right in the groin region, going medial to lateral. You would do this 5 to 7 times. Now remember, your MCPs are really what's working here. It's not the palm of your hands. Okay, so do that 5 to 7 times. Go on to your second hand placement. Okay, next hand placement. Each hand placement 5 to 7 times, and you can see that my MCPs are about right here, so that's good. Right after we finish this, we're going to start working on that knee, so this should be adequate for her. Each hand placement 5 to 7 times. Okay, so now once you have finished this, you're going to actually work that fluid all the way from the lateral all the way up to the axilla. So however you want to do that, I personally am going to use stationary circles, and we're going to go all the way up to the axilla. 5 to 7 times. Okay, 5 to 7 times. Now we're going to work on the knee. We finished that medial to lateral right above the knee, so we're going to work above the knee, at the knee, below the knee. We'll start above the knee. You can do this with a pump technique, but I'm just going to simply do stationary circles 5 to 7 times above that knee. Now, depending on if your client has knee pain, you can do a pump right over the knee, but you'll want to be very careful of that patella. So I'm going to just do a pump right over the knee. Five to 7 times. You'll want to go on the medial and lateral side of the knee using that stationary stretch. Stationary circle stretch 5 to 7 times. Okay, you're going to have your patient just bend their knee just a tad bit so you can get your hand in there, and you're going to go in the posterior aspect of the knee 5 to 7 times. Okay, and now this is a medial ventral bundle. It gets congested, so you're just going to take your MCPs right below the patella, right on that tibial ridge, and do a stationary circle 5 to 7 times. All right, we're going to start working on the lower leg. You want your client, if they're able, to go ahead and bend their knee. You can use whatever stroke you feel comfortable with. Just to be efficient, I'm going to do a scoop pump stroke all the way up her leg. So we're gonna start up here, do that scoop, pump. So with this stroke, you're getting both the posterior and anterior aspect of the lower leg. Do this 5 to 7 times. Okay, you would repeat that 5 to 7 times. Now we're going to go above the ankle, at the ankle, and below the ankle. So let's go ahead and have your client straighten the leg again. At the ankle, I'm just going to do the same thing we did at the medial lateral side of the knee. I'm going to do those stationary circles 5 to 7 times. Okay, we're going to do it at the ankle. Five to 7 times below the ankle. And now once you get to the dorsum of the foot, you can do thumb circles, but I like to do those dynamic stationary circles just because you get more bang for your buck. So watch your hand placements. You're probably going to have to do 2 hand placements here. Okay, your second hand placement on the dorsum of the foot. All right, so now we get to rework everything going up. So when we rework, we do everything 2 to 3 times. So rework the inferior aspect of the ankle, at the ankle joint, above the ankle joint, just 2 to 3 times. Okay, have your client bend their leg, anterior, posterior, the lower leg, 2 to 3 times. Okay, you do that 2 to 3 times. Now we're at the knee. We're right over that ventral medial bundle. Stationary circles 2 to 3 times. Okay, at the joint line 2 to 3 times. Anterior knee, we're just going to pump as long as their patella is okay with us pumping right over it 2 to 3 times. Okay. Above the, actually we're going to do posterior real quickly, just a little bend 2 to 3 times, stationary circles. Now above the joint line. Okay, we're going to go from medial to lateral, just 2 to 3 times. We're reworking. Move your all the way up. You want to make sure you're pretty medial starting. And do one more hand placement right here. All right, so we need to do the anterior aspect of the leg, and then we're going to move all that fluid that we just moved medial to lateral up. So we're going to do pump. All the way up to the ASIS. We're reworking, so 2 to 3 times. Okay, and now we've moved fluid up, so we're going to go ahead. We're going to start from where we were moving medial to lateral. We're going to move that fluid all the way up to the axilla. You want this to be slow. Okay, we're gonna rework that AII. So we're gonna go from the affected to the unaffected, ASIS to ASIS. You can do this from above her head, which I've been doing this, or you can do it from closer to her feet, which I'm doing now. This is 2 to 3 times. Now we're going to have your client go sideline so we can rework that PII one more time. All right, so we're going from affected to unaffected, working the PII. Okay, I want you to go ahead and lie back on your back. We're going to rework the inguinal lymph node on the unaffected leg. So I'm going to go ahead, I'm going to come over here. I'm going to be going towards that inguinal lymph node. We're reworking, so just 2 to 3 times. And we're going to end with in-breathing. So go ahead and take a deep breath for me and relax. Take a deep breath for me and relax. Take a deep breath 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 and relax. Take a deep breath. Relax, take a deep breath, and relax, and take a deep breath,